Close the windows. Shut the doors. Run the air purifier. This is the advice Canadians are being asked to follow as dirty air chokes the country.
There's no amount of pollution that's safe for our lungs.
But what if going inside is not possible? Respiratory therapist Sara Han says it's a real problem for those living on the streets.
They're the ones who are the most vulnerable. They're the ones who don't have the tools needed in place to have healthy lungs.
Statistics Canada estimates more than 235,000 people experience homelessness every year. On a given night, there are some 25,000 to 35,000 people in need of a roof over their heads. Experts say numbers tend to go up when the weather gets warmer.
We know that people who are unhoused have a higher prevalence of cardiovascular and respiratory disease.
Dr. Naheed Dasani works with vulnerable people and hears about their struggles firsthand.
I'm hearing that it's not easy to breathe out there. I'm hearing a lot of people who are having difficulty with their medical conditions, particularly patients who are dealing with respiratory illnesses.
Federal Health Minister Jean-Yves Duclos expressed concern when asked about the issue.
It's completely unacceptable that in a developed country like Canada, people cannot have a roof over their head.
He says there is money earmarked to help.
But these resources are channeled through community organizations.
But advocates want to see more done to open up indoor spaces while these conditions linger.
I really wonder why it isn't, normal practice to have indoor spaces with clean air available for unhoused people and the ability for our governments to be able to scale up in response urgently.
Katherine Ward, Global News, Toronto.